You're listening to Greater Good Radio Hawaii. Please visit us online at greatergoodradio.com. Today's guest is Dr. Gary Bell, owner of Spinal Dynamics Hawaii in Mo'ili'ili, and is the owner of Serenity Spa and Salon in the Outrigger Reef Hotel, which has been recognized by consumers as one of the top spas in Hawaii. He also opened the Waikiki Plantation Spa in the Outrigger Waikiki on the beach. Being a chiropractor, it seems that industry is growing. How did you become inspired to be a chiropractor?
Well, actually, my first inspiration back in the late 1980s was to go into medicine. My uncle's a psychiatrist in Kailua, and I'd only been exposed to medicine and medical. I hadn't really had any formal exposure to alternative healthcare. Basically, took an injury to myself. I had a really bad accident, fractured a couple of vertebrae, and all I heard was surgery and drugs. That's all that was given to me. My family member said, try alternatives if you don't want to have surgery. My mother basically sparked a little intuition with me and, said, well, maybe go to a chiropractor. She had a chiropractor that she had seen, but he was on the East Coast. She was living over there at the time. And basically I went to go see this gentleman, and, well, I took my seat at John Burns Med School and gave it to somebody else. And
were you trying other methods of medicine before you went to the chiropractor?
I did. I'd actually went to a physical therapist. I'd gone to see another chiropractor in Kahala, and he was what they considered more of a straight chiropractor, and he wasn't necessarily skilled in some of the more advanced techniques that other chiropractors were using at the time. He was a little bit, how should I say, he'd probably been in the industry for 20, 30 years.
Old school.
And it didn't necessarily help me. But then again, just like with medical doctors, there's different types of treatments for different types of people, and just because you don't have the perfect experience with one doctor, you can, that's the thing, freedom of choice. I went to go see another one, and he basically changed my life and my direction.
Your first visit to a chiropractor was when you were injured and trying to figure out what's going on with your body. Is a chiropractor service needed only when you're injured or need medical assistance? Who comes to a chiropractor?
Well, that's a good question, because what we find over, how should I say, the demographic of who sees a chiropractor. Typical patient is actually they're educated, they're baby boomers, they're 20 to 45. They're higher income earners. Being that they're more educated, they actually understand a little bit more about the healthcare system, and they know what they want to get out of it. And typically, in what's happening over the last, say, 10 years, is that, and you'll see it in the marketing. Kaiser, it's a little bit more health and wellness oriented. The images that they're using, they're trying to get people off of drugs. Well, they're sort of taking the chiropractic mantra to heart now, where our whole premise is keep people healthy, don't wait for things to break in order to seek care, and live a healthier, more holistic lifestyle. I mean, Andrew Weil is coming out speaking about these things, Deepak Chopra. Interesting is that they have MD after their name. They know where the puck is going. If this is a big hockey game, they're going to be where the puck is going to be. They're not chasing after it like everybody else. And that's where pretty much we are with our corporation. We understand that there's a healthcare delivery system, and now interesting is people are seeing that there's a wellness care delivery system. And it's better to stay healthy than wait till you get sick and then go take drugs and then worry about the side effects of those drugs. So people have a choice.
Thanks for tuning in. Stay tuned for more on Greater Good Radio.